It's a broad question for the CDC and what the Biden administration does here. There are concerns expressed by some that if the administration appeals this and really takes it up through higher courts, that you could see sort of broader challenges to CDC's public health authorities, even beyond the current situation that we're in. And we are in a situation where the CDC, of course, had just said we should keep that mandate in place on planes, trains, and other forms of transportation, at least until early May, because we are in a situation of uncertainty right now with a new variant that is driving at least cases higher. So we are seeing cases up more than 20% over the past 2 weeks across the United States, now to about 33,000 per day. But of course, when you look across the U.S., that's not even. You're seeing much bigger increases in some areas of the country, particularly in the Northeast. However, hospitalizations are near pandemic lows right now. Deaths have also come down. They are lagging indicators. Hospitalizations are rising in some parts of the country. You can see here the states in red, mostly in the Northeast again, are where you are starting to see increases in COVID hospitalizations as well. That could be driven by a new variant. We've been hearing about BA.2. This, of course, is the newer form of Omicron that is more contagious than the previous form of Omicron. Now there is a new version of BA.2 called BA.2.12.1, and I really hope that gets a better name if it sticks around. Unfortunately, it looks like it might be sticking around. It is gaining ground on BA.2. You can see it in the blue there. Now 19% nationally of the cases that CDC is sequencing, and really more predominant in the New York area. So the question right now is just what are we going to see going forward in terms of cases, severe disease? That is the big question. And you'll see that, some places like New York's MTA are keeping the mask mandate in place. Philly, of course, reinstating its mask mandate. On the local level, you might see that. But, of course, bigger questions for the CDC, Kelly.
And what about the effectiveness of the vaccines? We watch China and its response to the outbreak there. We look at the U.S. and try to figure out what portion of this has to do with literally having different vaccines, having different vaccination rates, being exposed to different versions of COVID, including the new numerically heavy one that you mentioned. And older people here have been getting their boosters. Younger kids still can't get the shot, but then we wonder if that shot would even be effective. What's the latest that we know?
Well, we know that the vaccines work really well, particularly if you get boosted. And now there is that recommendation for certain groups, vulnerable groups and older people, to consider getting a booster if it makes sense for them. The U.S. vaccines have held up better than the Chinese vaccines. We need to see data against this even more emerging version of Omicron to see how that looks. But we are seeing really good protection against severe disease, even in kids where, it looked like the protection from 2 doses for the 5 to 11-year-olds wasn't great. The severe disease protection does look very strong. And so parents of kids under 5, of course, waiting for more data from Pfizer and word from the FDA on Moderna's application for that group to potentially get protected.
Absolutely. Meg, as always, thanks very much. We appreciate it. Meg Terrell with all the latest.